Good afternoon, everyone. I'm very excited to be here as well, and I had the opportunity to stop in and talk with Rich Besser, the president and CEO of the Robert Wood Johnson Foundation yesterday afternoon, and he wanted me to send along his special greetings and his special thanks, Cheryl, to you and Dr. Zhao and the entire staff of the National Academy of Medicine, Dr. Williams and Dr. Wakefield for your leadership of this committee, and certainly to all the committee members, Rich and all of us at the Foundation deeply appreciate your service. This is so important. I also want to call out in particular Carrie Haver and other staff here that I know are going to be so instrumental to support the study, along with express my deep appreciation to Susan Reinhardt and the entire staff at AARP and the Center to Champion Nursing, and of course my good colleague, Dr. Sue Haasmiller, who has been leading us at the Foundation and really across the country as we've made so much progress over this past decade. So my task is to talk with you about your task. And in order to do that, I'd like to set a little bit of context. So let me say, first of all, that the Robert Wood Johnson Foundation's commitment to nursing goes all the way back to our founder, General Robert Wood Johnson. And General Johnson had experiences in his life that proved to him the value of nursing care, both in terms of restoring health and promoting health. So really, from the very beginning, over 45 years ago, the Robert Wood Johnson Foundation has worked to improve health and healthcare and to support and call out the special importance and leadership of nursing. In 2015, we did make this pivot to a broader vision around working with others to build a culture of health in our country. This notion of a culture of health that provides everyone in America with a fair and just opportunity for their best possible health and well-being. Now, this vision is based on our understanding that health is influenced greatly by a number of complex and interacting social and economic forces, environmental forces. And it's not just affected by the health care that we receive, although that is incredibly important. We know that these complex social and environmental factors, such as where we are born and where we live, what our incomes are, the strength of our families and our communities, the quality of our education, all of these things together shape our health over the course of our lifetimes. We also know that there's extremely wide variation in these factors, and that means that as a result, not everyone in America has the same opportunity to experience the best possible health and well-being. And so I think all of us in this room and across the country listening in are familiar with the grim statistics. We can recite them. You probably have your favorites. But we know, for example, that our country, compared to our peers across the globe, spends the most, but actually amongst our peers gets the worst in terms of health outcomes. So if we look at population health indicators like infant mortality, where last year in 2018, African American infants were twice as likely to die in their first year of life as white infants in 2018. And we also know that last year, for the second year in a row, life expectancy for Americans dropped. So it's in this very sobering context that we're providing this charge to the committee. And even though it's a very sobering context, I would say to you that our charge is meant to be very future-oriented and very hopeful. And that hope is based on our belief that as the largest and most trusted health profession in the United States, that nursing has both a unique opportunity and a corresponding responsibility to improve our nation's health. The statement of tasks tells you that this study will, quote, chart a path for the nursing profession to help our nation create a culture of health, reduce health disparities, and improve the health and well-being of the U.S. population in the 21st century. So we want you to think about the future. And to think about the future, I think we often do two major kinds of activities. First of all, we look to the past, either for warnings or for lessons, for examples. And then second, we look at the present for things that might portend to be the future, trends that we want to reinforce. So as you begin to chart this path for the future of nursing, I would like to suggest that the committee keep two quotes from two very different American authors in mind: William Faulkner and William Gibson. Very different authors. So William Faulkner said, "The past is never dead. It's not even past." And Gibson said, "The future is already here. It's just not evenly distributed." So to illustrate my point, I'd like to ask you to think about this scenario. So in this scenario, we are in the midst of a national health crisis, one that is killing a human being just about every 12 minutes. The epidemic disproportionately affects people of color, people living in poverty, people using intravenous drugs. There's also a great deal of stigma with this condition. And because of the stigma and because of the impact of the condition itself that often prevents people from working, many people that are affected by this condition end up displaced and looking for places to live. Now, in this scenario, the conventional wisdom says that the housing issue is not a health issue, or at least it's not primarily a health issue. But in a Midwestern town, a nurse, a Mennonite pastor, a community member living with the condition, and a lawyer come together to make it their common concern, creating a community-based organization to respond, first by building housing services for those affected and their loved ones, and then wrapping around nutrition services, social supports, volunteer supports, food, transportation, wrapping those services around health and around housing. So I'm familiar with this story because I was the nurse, and the year was 1987. And the condition was AIDS, not the opioid epidemic, as you might have been thinking as I was describing the scenario. So the past is not ever past. Nurses have long collaborated with others to create these kinds of bright spots. But that leads us to ask the tough question: why is it that these types of models are not more widespread? What are the barriers to implementation at scale? The future is already here. Why are innovative models not more evenly distributed. In the case of comprehensive service models like the AIDS service model and many other approaches that have been developed by nurses or nurses in collaboration with others, I think what we can see is that there are multiple factors. There's inadequate resources, there's the lack of reimbursements and payments, there's inadequate attention to racial and economic and class inequities. So while we certainly want you as a committee to seek out innovation, we want you to find where the future is already present. Please also think about the policy, systems, and environmental changes that have to take place in order for these innovations to become widespread and to be implemented by nurses and others throughout our country in every community. Thus, with the statement of task, we have provided you with a charge that includes, I know the committee's talked about this, a whole lot of things. We would like you to articulate the role nurses can play in improving the health of individuals, families, and communities by addressing social determinants of health. We would like you to help us understand where and how we can deploy nurses in multiple settings, how we can facilitate their collaboration with other health professions and with other sectors. We want you to tell us what the obstacles and opportunities are that you see for a diverse nursing workforce that can better understand the complex factors that shape both health and illness. We'd like you to help us understand how nurses can ensure that individuals, families, and communities have a voice at the table where policies are being made that determine an impact on health. We want you to identify the training and competencies nurses need to do this work outside of acute care settings and within acute care settings and in the community. We want you to help us understand the ability of nurses to serve as change agents in creating systems that bridge the delivery of health care and social services. We'd love for you to pinpoint additional research that needs to be done in order to develop effective nursing practices for eliminating gaps and addressing inequities. And we would also like to know about how we can support nurses so, as Dr. Zhao said, we can address the issues of burnout. We need to support resilience so that we can assure that nurses, our largest healthcare workforce, are able to support the changes that need to happen and address the many needs of patients, families, and communities. So let me close with one more quote. I'd like to share with you a quote from the great Lillian Wald, who was a nursing and public health leader in the last century. And she wrote 85 years ago, quote, "The call to the nurse is not only for the bedside care of the sick, but to help in seeking out the deep-lying basic causes of illness and misery." So in meeting your challenge, your charge as a committee, you will be envisioning not just a future where nurses are engaged in rooting out these causes of illness and misery, but envisioning a future where illness and misery, particularly misery that's impacting populations differently, some more than others, that illness and misery is a thing of the past. Thank you very much.